बिस्मिल्लाहिर्रहमानिर्रहीम। अस्सलाम वालेकुम। तो आज हम बात करने जा रहे हैं इस्कीमिक हार्ट डिजीज़ के बारे में। सो व्हाट आर इस्कीमिक हार्ट डिजीज़? These are the group of syndromes which are due to the myocardial ischemia, and that myocardial ischemia is caused by the imbalance between the myocardial nutritional demand and that supplied by the coronary artery. It is a group of syndrome due to the myocardial ischemia, and that myocardial ischemia is due to the imbalance between the myocardial nutritional demands and that supplied by the coronary artery. The myocardia need much more oxygen and nutrition while it is much less supplied by the coronary artery, and this results in the ischemic heart diseases. And these ischemic heart diseases are mostly, or about 90% of these are due to the atherosclerosis of the coronary arteries. Atherosclerotics of the coronary artery, and other 10% can be due to any other reasons like the vasospasm, etc., or the catecholamine induced vasospasm. A lot of other reasons which can cause this kind of ischemic heart diseases. Now, what are the clinical manifestations of the ischemic heart diseases? So, there are four clinical manifestations of the ischemic heart diseases. It may be in the form of angina, it may be in the form of myocardial infarction, it can be in the form of sudden cardiac death, or it can be in the form of chronic ischemic heart disease with congestive heart failure. The first three can be acute, while the fourth one is mainly chronic. As it is acute, so these first three are called the acute coronary syndrome, but keep in mind that in acute coronary syndrome the type of angina is unstable angina, not the stable angina or the Prinzmetal angina. It is the unstable angina, myocardial infarction and the sudden cardiac death which comes under the headings of acute coronary syndrome. Why it is called acute coronary syndrome? Because it occurs when the blood supply is abruptly stopped to the heart. When blood supply to heart suddenly or abruptly stops or blocks, and it mainly occurs, the blockade is mainly occur due to acute plaque change in the atherosclerotic plaque, due to the erosion of the plaque, due to the rupture or the ulceration of the plaque, and it can lead to the formation of thrombus which can block these coronary vessels, thrombus which can block the coronary arteries, or there may be thromboembolic composition of these thrombus which can lead to the blockade of the coronary artery. So they can lead to the acute coronary syndrome in the form of unstable angina, MI, and the sudden cardiac death. The first topic, or the first clinical manifestation, in this lecture we will study only about the first clinical manifestation of the ischemic heart disease. It is called the angina or the angina pectoris. So what is angina pectoris? It is the intermittent chest pain, or I will change the color. It is the intermittent chest pain caused by the transient reversible myocardial ischemia. Keep in mind, it is intermittent chest pain caused by the transient lasting about 20 minutes. The maximum 20 seconds is reversible. It can be reversible through the treatment like nitroglycerin or rest myocardial ischemia. So what is the pathogenesis behind this chest pain? Whenever ischemia occurs, ischemia जब हो जाता है तो ये क्या कर लेता है, ये एडेनोसिन और ब्रेडिकाइनिन को, जो पेन रिसेप्टर को स्टिमुलेट करते हैं, इनको रिलीज कर देता है, और these adenosine and bradykinin will in turn stimulate the autonomic nerves, and this in turn will cause the pain. In turn will cause the pain. Now talking about the variants of the angina, so it may be stable, it may be unstable, or it may be Prinzmetal stable. The first is the stable angina. The first is the stable angina. So what is stable angina? It is the chest pain that arises with the exertion or the emotional stress. It is the chest pain that arises with the exertion or any emotional stress like happiness, grief, etc. And it is mainly due to the atherosclerosis of the coronary artery when it blocks the coronary artery greater than 70%. Less than 70%, if it is less than 70%, अगर ये 70% से कम होगी तो क्या होगा कि it will be asymptomatic. There will be no symptoms. Asymptomatic. Now what will be the signs and symptoms? There will be chest pain lasting for less than 20 minutes. As I have already discussed that they are transient, and this chest pain will radiate toward the left jaw or left arm. There will be sweating and there will be shortness of breath. Now how to diagnose the stable angina and the EKG? On the EKG we will see that there will be ST segment depression. And what is the reason behind this ST segment depression? The reason behind this is due to the subendocardial ischemia. So whenever जब भी subendocardial ischemia होगा, so its hallmark will be ST segment depression. और subendocardial ischemia क्यों होता है? क्योंकि जब भी ऑक्सीजन कम होता है, so this subendocardium, whenever the oxygen becomes low, this endocardium is the most sensitive area to the injury. For example, अगर हम देख ले कि ये हार्ट का वाल है, तो उसमें जो है और ये इसका लूमेन है, हार्ट का लूमेन है. तो हार्ट वॉल कंसिस्ट ऑफ 3 muscular layers or 3 layers. The first one is the epicardium, the second one is the myocardium, and third one is the endocardium. तो blood vessels from the epicardium through myocardium endocardium में आता है. तो so the most sensitive area to the ischemic heart disease will be the myocardium because it received the blood, the last one. It is the last area to receive the blood, so it will be the most sensitive area to the injury due to the myocardial ischemia. Okay, there will be no necrosis. No necrosis in the myocytes. So when there is no necrosis, so it means that the injury is reversible, as I have already discussed. The treatment, it can be relieved by giving nitroglycerin. Now coming towards the second angina, which is the unstable angina, also known as the crescendo angina or the pre-infarct angina. These are the some names for the same unstable angina. It is the chest pain which occurs at the rest. It can be occur at the rest. And what is the cause? It is due to the rupture of the atherosclerotic plaque, and this rupture will lead to the formation of thrombus, and this thrombus can incompletely keep this word incomplete. This thrombus will cause the incomplete occlusion of the coronary artery, and this will lead to the unstable angina. The same, there will be no necrosis of the myocytes. There will be ST segment depression, and there is much more chances of the unstable angina to progress into MI, myocardial infarction, and it can be relieved by the nitroglycerin. There is acute depression. There is no necrosis. It has much more chances to progress into the MI, and it can be relieved through the nitroglycerin. But how to distinguish between the unstable angina and the acute MI? They are mostly ये दोनों एक ही जैसे होते हैं, but the only difference is that there is ST segment depression in the unstable angina, while in the acute MI there is ST segment elevation. So through these two points we can distinguish between the unstable angina and the acute MI. Now coming towards the Prinzmetal angina, so it is the episodic chest pain, and it is unrelated to the exertion. It is caused mainly due to the coronary artery vasospasm. The same, there is no necrosis. There is no necrosis in the myocardial cells, and the EKG shows the ST segment elevation, and this ST segment elevation is due to the transmural ischemia of the heart wall. Transmural, what transmural means? Throughout the thickness of the heart wall. And this transmural ischemia of the heart wall will result in the ST segment elevation, and it can be relieved through the nitroglycerin or by giving calcium channel blockers. So that's all for today. Thank you.